A very good morning to you. I'm Howard Feldman. This is the Synthesis Sunday podcast with me, Howard Feldman, and Dr. Anton Meyberg. Don't forget to subscribe to our YouTube channel so that you get these updates as and when they become available. There is little debate about the lack of success around the vaccine rollout. As we fast head towards May, South Africa is now standing behind countries like Equatorial Guinea and Sierra Leone. That is with our rate of vaccines per 100 people. With less than 300,000 people vaccinated, there is little inspiring about the rollout. Dr. Anton Meyberg, good morning. If I am a little despondent this morning, I believe it's with good cause. What do you think?
So good morning, and I understand your despondency, but I think there's lots to hopefully look forward to, and I think we're going on the right path, and hopefully we're going to move forward and take things in the right direction. We're currently sitting on 141,330,976 cases worldwide, with 3 million deaths and 119 million cases resolved. The United States has 32 million cases with 580,000 deaths, and South Africa has 1,565,680 cases with 53,711 deaths and 1,326 new cases in the last 24 hours with a 95% recovery rate. Gauteng, numbers are low at the moment, has 1,278 patients in hospital with COVID-19, of which 283 are in ICU and 123 are currently ventilated. The daily positivity rate has, however, gone up to 9.3% from 5% over the last 3 weeks. And in the past week, particularly Gauteng province has recorded the highest proportion of SARS-CoV-2 or COVID-19 cases.
What are you seeing in the hospitals? In your hospital, I see you're on call this weekend.
So, we did expect the third wave to come much sooner, but it's kind of slowly trickling upwards. So the numbers aren't too bad at the moment. We have opened a second ward in the hospital to cater for more patients. So that's showing you that the numbers are going up. And we are expecting now 10 to 14 days after the Easter weekend that the numbers are going to go up much higher, unfortunately.
Is it possible that we won't have a wave, a third wave, as we did a second wave, but rather that the numbers will increase and then ebb again?
Look, I think only time will tell. If we follow the models, and the models have been continuously right with regards to these waves, then there's no doubt that we're going to have a third wave. I think we're seeing numbers trickling upwards slowly, but I think people have also become a lot more sort of relaxed about everything going on and aren't taking it as seriously as they were.
It's very difficult to keep taking it seriously. It is very, very hard when the numbers aren't that high to keep reminding ourselves that the third wave is potentially around the corner.
Especially when you're looking at countries overseas like Israel that are going back into circulation without masks, going back into normalcy. And our country, due to our poor vaccine rollout, as you've said, as well as many other extraneous factors, is still nowhere near that.
Right. So where are we with regard to the vaccine? Obviously, in the last week, we noted, because of the concern with 6 American women having blood clots, the rollout was paused. Is it back on track? When do we hope it'll be back on track? What is going on with this in this regard?
So I think that's a very important question. And I think we've got to actually also break it down to what the actual issue is. The case studies and everything showing that 6 out of 6.8 million people who were vaccinated with the Johnson & Johnson or the Janssen vaccine got these clots. And they're not typical blood clots like clots in the lungs. They're what we call central venous sinus thromboses with thrombocytopenia. So that's a type of a clot found in the brain associated with a low platelet count. And they've come up with a new medical term, as we always do for these things. It's called VIT, which is vaccine-induced thrombotic thrombocytopenia. So in other words, it's a low platelet count together with clotting caused by the vaccine. But there's no actual underlying condition that makes you more susceptible to it at this point in time. The scientists haven't found any causal relationship between an underlying medical condition and you going for a vaccine and getting one of these types of central venous sinus thromboses. The only thing that's common at the moment is it's in younger women aged 18 to about 48. And there's also, it's associated with antibodies against your platelet factor 4, which goes with the low platelet counts. There are already treatments out to how to sort of counteract this if it does happen into you, what medication to use. We use different types of blood thinners, which are not heparin related, as well as gamma globulins. And the question is, how do you know it's going to happen? You've actually got to look for the symptoms. We all know that within 24 to 48 hours, you can develop a headache, you can develop myalgia or muscle pain or fever. That doesn't mean you're getting a clot. But if within like 5 to 20 days post-vaccination, you get severe headaches, shortness of breath, severe muscle pain, nausea and vomiting or abdominal pain, then you need to alert your medical practitioner to say you're worried something's wrong, and they need to assess you by either doing a full blood count, or if necessary, if the full blood count is low, showing a low platelet count, do a CAT scan. But as we said, this is a very, very rare condition. If you're looking at 6 people out of 6.8 million people, the statistician will tell you it's 0.000 whatever % of people that can actually get this type of condition. And funnily enough, SAHPRA came out on Friday with a statement saying that there's no major safety concerns that have been identified by using the Johnson & Johnson vaccine. There's no causal relationship they have found between the vaccination and blood clots at present, but they are covering themselves, and they're waiting for further sort of outcomes from Europe and from America to see if they can continue using the actual vaccine. There's also a very important question is there's no actual information on this VIT, that's the vaccine-induced thrombotic thrombocytopenia, and the fact if a patient's got blood disease or if they've got an abnormal clotting factors or they've got a pre-existing risk factors for clotting, or if you've got autoimmune disease, to say that you shouldn't be vaccinated. So you should be vaccinated at this point in time, even with the Johnson & Johnson, but just need to be made aware for symptoms post-vaccination.
Can you give us a comparison with the incidence of blood clots in other areas? I mean, I know there's been, we've spoken about birth control, about smoking, about COVID-19 itself.
That's the point. I mean, there's so many other conditions that can cause clotting or can cause pulmonary emboli, can cause clots in the brain, clots in the stomach. And the biggest factors are birth control pills, smokers. And more important than those is actual COVID-19, SARS-CoV-2 itself, which can cause a much higher percentage of blood clots in patients who have not been vaccinated against patients who have been vaccinated. So we've got to be very careful at the way we look at data and the way we understand how people are presenting it to the public forum before we get excited about saying we don't want the vaccination.
And isn't it relevant as well that the Americans have a number of alternatives? They're still vaccinating millions of people every day in order to get them some form of immunity. We have no alternatives at this point. There is nothing else happening in this country. Surely that in of itself should sway us towards continuing with this process.
100%. I mean, there is also studies out overseas that even the Pfizer and Moderna can cause a thrombocytopenia, a low platelet count, but is not yet associated with this VIT-type syndrome. So we have got no options at the moment. We are hoping to get the Pfizer vaccines, a few million of those in the next few weeks. But at this point in time, I would still advocate the use of the Johnson & Johnson vaccine.
And I think it's also relevant that Americans, they're a little softer than we are. They write on their coffee cups, caution hot liquid, in case they spill it on their laps. And they have to write on their shampoos, do not drink the shampoo, because, one could be overcome by a desire to drink your shampoo while you're in the shower. So I think, South Africans are
I have to agree with you. I mean, these are the people that play rugby with pads on their shoulders and helmets, so, the proof of the pudding.
Point. Right, exactly. We laugh in the face of concussion repeatedly, even when it's not funny. Right. So let's move on to some of the questions. Lucille wants to know: should anyone with a clotting gene avoid having a J&J vaccine? I'm specifically referring to a single gene. It's called something like 20210A.
She's talking about prothrombin gene factor abnormality. So as I said, there's no specific data to say that if you've got a pre-existing clotting abnormality, you shouldn't be vaccinated. More so, we think that you should be vaccinated because the higher risk that you can get clots or pulmonary emboli from COVID-19 itself. So as I said, there's no scientific data showing any causal relationship as of yet. But we want to space carefully, and we're waiting for the rest of the world to give guidance forwards.
All right. They're really tough questions today. Sally Ann wants to know, what is the significance of a negative spike protein antibody test 6 weeks after receiving the J&J vaccine? Is this a vaccine failure or defective vaccine? Laboratory tests specifically for the spike protein antibodies are not for the nucleo something antibodies. I'm going to hand this to you to answer.
That's quite a tough question. That's basically like asking how long is a piece of string. I think the important thing to understand here, and this is a very important thing, is that we're very much instant coffee, instant gratification type of people. So we won't answer straight away to things. But the guidelines from the CDC is that they discourage antibody testing post-vaccination to assess your immunity. And I think there's good reason for it, for reasons like you've just asked in the question. In other words, from what I understand from the question, the person's asking is because they've had their vaccine 6 weeks later, surely they should be able to test for antibodies and make sure they've got antibodies to the spike protein, which is an IgG, which is an immunoglobulin G antibody. And we know that vaccinated people can get negative results from serology tests because there's two types of serology tests. The one looks at the spike protein, which is the S protein, and the other one looks at the N protein, which is the nucleocapsid protein. Now, the nucleocapsid protein is only positive if you've been vaccinated, if you've basically been vaccinated or you've had a viral infection. But the S protein, and that's the one people are looking at, is only positive after vaccination. So it's not if you've actually had a viral infection. The problems that develop with this is that if you're immune suppressed or you're elderly, you do take a longer time to mount an antibody response to these vaccines. So just because you get a negative result 6 weeks later doesn't mean that you haven't mounted a response. And more importantly, this doesn't look at your T cell response. And your T cell response is your body's reaction or immune sort of system reaction to the coronavirus in your body. And it doesn't take into account your actual antibody production. So I think that because if you do produce a negative antibody to this S protein IgG, don't be nervous to say that you definitely haven't taken to the vaccine, because also find some people do develop antibodies that are not in the threshold. They're not high enough to be in that threshold that the labs test for, but they still are covered. So at this point, I would say that it's nothing to worry about, but we're going to watch it forward because we know that there are other types of immunity that develop throughout this whole period.
An interesting discussion was with regard to a number of kids from South Africa who have gone to Israel recently on programs. Many of them had the South African, the so-called South African variant. Many of them were asymptomatic, in fact, had the variant. But what they're finding is that their antibodies are very, very high. Did the second wave that hit South Africa with this new variant, did it seem to produce more antibodies than the first one did? In your
Well, I don't know if it's because we're better at testing for these things now than we were during the first variant. Remember that we didn't have all these antibody tests during the first wave. True, so it's very difficult to answer that question without comparing data.
Right. But the people that had the first variant in South Africa, are we still of the belief that they are not protected against the dominant variant, which is the newer one?
Yeah, I think that they've definitely got some sort of protection. And that's why we're saying that, even if your vaccine doesn't cover you 100% against the actual variant, it's still going to confer some sort of immunity, some T cell immunity, and some other sort of antibody immunity that will protect you in some way. Just how much we don't know yet, but it won't be as efficacious as having had the new variant.
Do we yet have a sense, and I know that we asked this question, we discussed this over the last couple of months, as to how long these antibodies will last in the system? And of course, it was still too new to know those answers. Are we closer to having an idea?
So if you look at what Moderna and Pfizer are saying, is that they do believe that you will need boosters in the next 6 months. So if that's the case, then it's only 6 months. But once again, time will tell over the next few months when they get more specific tests and we get a bigger extrapolation of the population to see who's been vaccinated and how many antibodies there are to these type of variants, what the actual lasting outcome will be, and if we'll need yearly vaccines or if we're going to need boosters. Even having had the Johnson & Johnson vaccine, people don't know yet if they will need a booster somewhere down the line, or if they will actually be able to get a Moderna or a Pfizer one to boost them, which I don't see it as a major problem, but it might be the reality of the situation.
The president made a throwaway comment while visiting the port in Durban last week that they're also looking at the Sinovac and Sputnik 5. Now, not even the Chinese are using the Sinovac, so that would be quite surprising because they're looking at blending it with others. But what is your research, and what are your thoughts on those two vaccines?
So today, on the 18th of April, I wouldn't let anyone use the Sinovac vaccine. I'm not happy with that. The data is not great with regards to it. With regards to Sputnik, the Russian vaccine, there is promising data coming out of there. I'd like to see data from other countries first before we rush and get it, to see that we're happy with it, because we just don't know what the Russian population is putting out there is real and what's not real. And we need to see it studied on other continents to see if there's a good feeling about it. But I do have a good feeling about it myself, saying that I think it will be quite efficacious and quite a good sort of have a good role playing in Africa.
Right. So just to summarize, the Sinovac is, in your view, not an option at this point.
I wouldn't want to have the Sinovac personally at this point.
Right. Well, as I say, it's not even something that the Chinese are looking to use. And Joshua wants to know, is there such a thing as PTSD from people who have had COVID?
So that actually falls into your category of what we call long COVID, that we discussed many times. And it's a very, very significant problem. And we find that post-traumatic stress disorder is more significant in people who are actually in hospital, who are on oxygen, who are more severely affected by COVID-19. Those people do have a lot of more panic attacks, a lot of more stressful situations, worry about the people around them, worry about getting the virus again. And it's a real thing. It's a very, very real thing. And it's going to be a thing that we're going to be seeing much more in the future, especially in the younger generation who've had basically curtailed sort of livelihoods over the last few months.
And Karen wants to know about the registration for the vaccine. That's not your field, really. We've kept away from those sort of things because that's not really your field. But I would imagine that you would encourage anybody, as soon as the registration is open, to make sure that the
registration came out on Friday for people over the age of 60 with COVID to register. And by the end of Friday, only 129,000 people over the age of 60 had registered on the EVDS portal, which is itself dismal. I mean, there are far more people than over that age, and it should have been much higher with regards numbers-wise.
Yeah, why would you think that is? Is that reluctance, or that might just be technological, I suppose?
I think it's more technological, and people aren't aware of the fact that they should be registering for it. It's not well communicated in certain communities, etc.
Right, and one of our followers on Twitter wanted to know, as a disabled person, will they be in a position to register? Surely, with their types of comorbidities, they should be able to register fairly soon, or shouldn't they be one of the first in line for the vaccine?
So my feeling is that people over the age of 60, people with comorbidity, should be first in line to register for the vaccine. They should be put in under the same umbrella and should all be doing it and be allowed to register as soon as possible. I did hear on one of the SHR webinars about Prof. Shub speaking about how it should be graded, how people should actually be sort of given a number of what their comorbidity is, what their age is, and be grouped into certain groups of who is the highest number in order to be vaccinated first. Where that's going to be done or not, we're not sure, but it is a very good idea.
Yeah, and I'm just saying the other interesting thing is, do you think that South Africa will be issuing these passports? Because many countries in the world are going to be requiring.
I think you can't even get a driver's license at the best of times, and you want to get a passport. Never mind this one. So I don't know. I think let's cross that bridge when we get there. Let's first get the vaccinations out. Let's first get more people vaccinated, and then we can see from there.
I read an article as well about what's going on in Brazil in terms of younger people being afflicted by COVID-19. What's your approach at the moment to kids?
Look, I mean, I think we still got to be very careful with kids. Okay? We don't know what's going to happen, if there is going to be a third wave, if it's going to be worse or not in adults. We have seen in certain countries overseas, the third wave, the children have been far more affected with more of the inflammatory disease type pictures from COVID-19. We still got to be careful. We still got to do our screening processes for our children, and we still got to make sure that they wear the mask at school, social distance in their classes, and just follow the rules so we can prevent these type of things going forward. We know that Brazil's a very different type of run country in the fact that they aren't getting the medical sort of stuff that they need. They're not getting the equipment. They're not getting the testing. They're not getting the right type of treatment, and they're using other types of treatment that are not advocated worldwide. So they're in trouble, and it's going to be a bit of a disaster in that country.
As we head into the winter months, the people are going to be more indoors. This is obviously becomes much, much more of a concern.
Well, it definitely does. And that's why we're advocating that you must have your flu vaccine. It's extremely important to have your flu vaccine. Ideally, you should have the quadrivalent flu vaccine. And as we said before, that's with 2 influenza A and 2 influenza B strains inside it. You can have the trivalent, which is as good, but first prize would be the quadrivalent one. And then knowing that we're going indoors now, it's very different to last year where we were locked up, where we didn't see any of these respiratory viruses. Now, we're seeing RSV, which is respiratory syncytial virus, in a large proportion in younger children, and it's changed trends so much so that we're actually starting to see it in adults as well. So that's very different to the way it used to be. There's a lot more virus shedding and virus spreading at the moment.
So can you just explain what that means again? I don't really follow that.
So basically, it's one of the respiratory viruses, which has been generally over the last few years, nothing to do with COVID. It's been found in the last few years, mainly in children, in infants and children under the age of 2. And it was very rare to find in adults. It's now almost crossing the barrier and going into adults now, spread from the children, which never used to spread to adults. And we're seeing sicker people in hospital with other viruses like this RSV. So in other words, we're going to see other viruses in winter. It's not only going to be COVID-19 like last year, and that's why it's so important to be vaccinated, to make sure you socially distance, to still wash your hands, and still have protective mechanisms in place.
Is there any way to distinguish these one from the other without a COVID test?
So look, I mean, you've got to go by your normal patterns. If you generally get flu every year and you generally wake up in the morning with a sore throat for a day or 2, but you've got no fever associated with it and there's no major muscle pain, etc., then it's generally a flu-like thing and you don't have to really worry. But if there's a temperature associated with it, if you're coughing, then you've got to be careful and you've got to either speak to your practitioner or stay at home to see if the symptoms go away. And if they don't, then you do need to be tested. And you just got to be very aware of these type of problems.
And I guess that's what you're saying is know your own body, know your own patterns. If it feels exactly how it felt every other year, then that's most likely what it is.
It's more likely it's going to be something else, yeah.
I'm hoping that there's some good news.
So there are a few parts of good news. The first one, as we discussed earlier, is that we now know that the EVDS is open for people to register over the age of 60. Although we know that the numbers are slowly increasing, up until now, we've managed to avoid the third wave. So please God, we can avoid that as long as possible. And an interesting study has come out this week that says that people who get the recommended amount of physical activity or exercise, we're talking about 150 minutes a week, basically them getting SARS-CoV-2 will be at a much lower exposure to somebody who hasn't exercised or somebody who's not looking after their physical needs of their body. And then, of course, our favorite team, Liverpool, 7 more games left to get in the top 4 position. Come on, you Reds, you can do it, boys. And to quote, if you won't be better tomorrow than you were today, then what do you need tomorrow for? Wishing you all a good week. Good luck for the week. Keep safe. Keep washing those hands. Keep social distancing and wearing your masks. And see you next week.
It's absolutely awesome. I'm Howard Feldman. This has been the Sunday Synthesis Podcast with Dr. Anton Meyberg. Don't forget to subscribe below, and that way you will make sure to get the latest information when it's available. As Anton said, have a great week, be safe, and God bless.